Hi, I'm Brandie Lawrence with the American College of Healthcare Sciences. I'd like to take a moment to talk to you today about psychoneuroimmunology and the role that aromatherapy, or more specifically, the therapeutic use of essential oils, can play in that. Psychoneuroimmunology is a really big word that can be broken down into its parts. It's referring to the brain, the nervous system, and the immune system. Hormones, which are the chemical messengers, are also involved in this. While most of us think of the brain as the control center, and we know it sends out various signals, either utilizing the nervous system or chemical messengers, which would be neuropeptides, hormones, and other molecular messengers. And it affects the immune system, telling it how to react in different situations. But this is not a one-way relationship. The immune system is constantly sending feedback to the brain. It monitors our internal body through the blood system and the lymphatic system. It has a role in sleep and body temperature. So this relationship is going both ways, with the brain affecting the immune system and the immune system giving feedback and sort of letting the brain know what decisions need to be made there at the control center. So what is the main concept behind psychoneuroimmunology, which I'm going to call P&I for short? The main concept is that a positive state of mental health, emotional health, consequences in positive or good physical health. So basically, positive mental thinking can lead to less disease and disorder, if you break it down and simplify it greatly. Well, how do we maintain this positive mental, emotional health in a world, in a society specifically within the United States that's bombarding us with stress and negativity? Well, I would like to hone in specifically on stress and P&I. P&I can cover many things in the psychological realm: anxiety, depression, ADHD, bipolar, all these issues, but I'd like to specifically get in on stress and P&I and what's going on in our bodies when we are under stress, and specifically chronic stress, as there have been numerous studies linking chronic stress to an increased risk for disease and disorder.
So what exactly is going on in our bodies when we're under stress? A stress response starts in the hypothalamus, signaling for release of corticotropin-releasing factor, or CRF, which in turn stimulates the pituitary gland to release a cascade of stress hormones. ACTH, which in turn releases cortisol, which in turn releases aldosterone. What exactly are all these hormones doing in our body? Cortisol stimulates the release of glucose from glycogen in the liver, which is going to increase blood sugars. Aldosterone retains sodium and water in the body, which will have an effect of increasing blood pressure. Cortisol also depresses phagocytosis, which will affect healing time, and the natural killer cells found within our immune system that attacks mutated cells, potentially lowering the action of anti-cancer proteins and allowing the mutated cells or dangerous passages to increase within the body. These increased levels of adrenocorticosteroids released from stress act as an immunosuppressant.
So what's the good news in all this stress in our lives that's wreaking havoc in our bodies? In 2008, a fascinating study was published called Healing Sense: Clinical Aroma in Emotional Distress. And in this study, they took a closer look at how immediate, observable physiological reactions can be noted as different odor molecules pass through the brain. And this is where aromatherapy really comes in. So what are some of these noted changes? Heart rate, blood pressure, skin temperature, electrodermal activity, our sleep arousal state, brainwave patterns, muscle tension, pupil size. All these things can be clearly seen as a change due to different odor molecules or essential oils that could be introduced to the patient. And basically these essential oils are creating a release of different neurotransmitters, for example, serotonin and norepinephrine, which in turn activate neuroreceptor sites within the immune system. This affects us by altering mood, reducing stress, and reducing anxiety. And that is some good news.
And now for the fun part, creating your own aromatherapy blend for relieving stress. Pick up bath salts, which could be sea salt or Epsom salt, jasmine essential oil, bergamot essential oil, and clary sage essential oil. Follow the instructions for the amount of drops for each. Be sure to store them in a glass jar. And when you're ready for your bath, run the water to its full and then add about 1 ounce of the salt and essential oil mixture. Relax and enjoy. Other stress-reducing oils are Lavandula augustifolia. Be sure to pay attention to the Latin names for all essential oils here, as it is very important. Lavender is known for its parasympathetic stimulant, and you may find that fragrance preferable to one of the others. The 2008 study on healing scents also noted lavender and rosemary showed a decreased salivary cortisol and an increased free radical scavenging activity by the immune system. This is very promising, as we just learned about the effects of cortisol and immunosuppressant activity of stress in the previous slide.
So maybe a long bath doesn't fit in with your hectic schedule. There's other ways to use these essential oils to help keep the stress down. Consider making a room spray that perhaps could be used at the office if your coworkers agree with the scent, or you could keep it in your handbag, in the car, as preferably that doesn't get too hot or is in direct sunlight, as that will affect the essential oils. But if traffic on a daily basis is something that really gets the blood pressure up and is contributing to your chronic stress, then spraying a little mist in the car is probably a good idea. You could just use either water or alcohol with the drops of essential oils and spray it into the room or car. If you do use water, please make sure you shake it very well to really get the oils mixed up and be able to diffuse into the air. Diffusers and oil warmers are other ideas to have at your desk or just at home, and have the essential oils with water in them sort of diffusing into the room. Humidifier is another tool to use, especially if you live in an area where the climate is very dry. Utilizing the humidifier and the essential oils is great on multiple accounts. Instead of a room spray, you could make a body spray using vegetable glycerin in place of any alcohol or water, and then your essential oil drops in a glass bottle like this, and you could spray it on as a body spray to help with the stress and relieving those things. So there's many ways to use the essential oils as a practical, quick, and relatively inexpensive tool to help keep the stress down. Please remember your safety precautions, consulting a certified aromatherapist, or doing a lot of research on your own, especially if you're pregnant or breastfeeding, as there's only a few essential oils that are considered safe to use during this time, especially if you want to put them on your body in a spray or a massage. Children under 5 also need special precautions. And again, if you've never been exposed to this essential oil or plant at all, you would want to do what's called a patch test with a little bit of the oil on the underneath part of the arm. You could put it on directly, or if you have any qualms where you're sensitive at all, I would recommend diluting a drop and a few drops of olive oil or almond oil or grapeseed oil, just a carrier oil, and then putting on the arm. Wait 24 hours to see if any sort of reaction comes to be. If it doesn't, you should be safe to use these oils. But again, please be safe and consult that book or certified aromatherapist. I would now like to turn you over to my fellow classmate, Wafa, as she will be taking you into another look at P&I. Thank you.